New research shows that the rates of breast cancer in women under the age of 50 are rising in Canada. The study, published in the Canadian Association of Radiologists journal Rates, reviewed breast cancer cases over the last 35 years. It showed that between 1984 and 1988, there were just under 4 cases per 100,000 people in women in their 20s. Now, between 2015 and 2019, that number rose to 5.7. That's a 45% increase. For women in their 30s, the number was up over the same time about 37% to more than 42. And then that's a 12.5% increase. Now, for women in their 40s, researchers noted an increase of just over 9%. Let's bring in Dr. Jean Seeley, the head of breast imaging at the Ottawa Hospital and professor in the Department of Radiology at the University of Ottawa. Doctor, thank you very much for joining us.
Thank you very much.
These increases are disconcerting. Any idea why we're seeing such a huge jump?
It's the really important question. We really don't know based on our study. The study shows similar increases what we see around the world. So there's a global increase of breast cancer by about 20% in the world. And what we're seeing here is that when we look specifically at the younger women, there's a 45% increase in the incidence in the women in their 20s. And as you noted, a 12.5% increase in women in their 30s and a 9% increase in women in their 40s. So this is really something that we're seeing around the world, but we don't know why this is. There are some ideas that maybe it could be related to the diet or changes in practice. We know women tend to have their menses earlier and they delay childbirth to later. So we think that may play a role. We also know that alcohol plays a role, especially when exposed to alcohol early in life, in teens, and that may have an impact. But we don't know, and there may be other factors, environmental or in our diet, that that could explain this. But we weren't able to look at this in our study. We just are noticing this, and whereas we didn't see this 20 years ago in women in their 20s, we're seeing it on a regular basis.
Should women now in their 20s think about getting screened? It's not a common occurrence, right?
No, and in fact, based on the incidence, we wouldn't recommend screening in the 20s or 30s. But what's really important is to be aware of risk factors. So if a woman has a strong family history with a mother or sister or more than 2 second-degree relatives, aunts, grandmother, grandfather, even a father with breast cancer, we should be evaluating their risk for breast cancer. And if they're at a high risk, over 20 to 25% lifetime risk, they should be in a screening program with an early program where we do MRI and mammography and start earlier than we would for an average risk woman.
And that earlier screening, it makes a huge difference, doesn't it?
It's life-saving. We know for women who are screened in Canada in the screening ages that the reduction of breast cancer mortality has dropped by almost 50% in the past 20 years. But women in their 20s and 30s, and unfortunately women in their 40s, have not been having the same benefit. So the incidence is high enough to justify screening women in their 40s, and we recommend starting screening for any woman age 40 or older. And if a woman has a high risk of breast cancer, she might benefit from earlier screening. But that would come with, estimation of lifetime risk, and that's the best way to determine it.
Are there any symptoms or signs that you can look for yourself when it comes to breast cancer?
It's really good for women to be aware of their own breasts and to notice if there's any change. If there's a lump, that's the most common cause or a symptom of breast cancer. Any woman who has a new skin change or nipple change, that's another symptom of breast cancer, and that should be investigated. So in a young woman under the age of 40, we would start with a breast ultrasound, and that's the best way to identify if there's any abnormality. If there's another abnormality, we would add the mammogram, which is what we start with any screening, but that's not done for younger women.
Okay. Dr. Seeley, thank you very much for your time today.
Thank you so much.
Dr. Jean Seeley is the head of breast imaging at the Ottawa Hospital and professor in the Department of Radiology at the University of Ottawa.